Hi, today I have Dr. Luisa Searle, and we are going to talk a little bit about her experiences as a consultant psychiatrist and a prescriber of medical cannabis. So, thank you very much, Luisa, for joining me today. And I would like to ask you first, what is your journey with medical cannabis? How did you get into this?
Yeah, so I was originally a consultant in substance misuse, so I still am. But I was just looking for work, as you do from time to time. You want to move on and just take on new challenges. And I saw an advert, I think it might have been in the BMA, for what was then called the Medical Cannabis Clinic. And I remember just thinking, what do you mean the medical cannabis clinic? Like, what even is that? I had no idea that the stories of little Alfie and things had kind of, I'd seen them, but they'd kind of washed over me a little bit. I hadn't really like taken it in. And so, I didn't have an understanding, like many people still don't, even now, even though that, clinics have really mushroomed, that medical cannabis was even a thing. And so I made an inquiry, and they were hiring, and they offered training and things. And yeah, I just sort of started with a few hours. It's about 3 years ago now. Just started with a few hours, did Prof. Mike Barnes training, but it was quite a lot like seeing in the dark initially. And yeah, just went from there. And I guess I stayed in it because I just started to get these narratives from patients that they were just transforming how they were feeling in a way that I hadn't really seen with conventional psychiatric medication. So, with conventional psychiatric medication, antidepressants, mood stabilizers, these kinds of things, a lot of patients were just sort of like almost like in a holding position. They weren't feeling worse, but they weren't necessarily feeling better. And they would often report things like feeling like that they weren't themselves, like there were elements of their personality that were being numbed or disguised by the conventional medication. And when I say medication specifically, in terms of therapy, I don't think medical cannabis is a substitute for that. But in terms of medication, I think it's a really good alternative. So I had these patients, actually feeling better and giving reports of observations by their family that they were back to themselves, that they were more engaged, more present, all of the things that we hope for people when they're on like a recovery journey. And so that's what's made me stay, really, just to see my patients getting better.
Okay. Okay, so I wonder, beforehand, you had a lot of experience in substance misuse as well as a psychiatrist, and I'm
Yeah.
wondering, what was your experience with cannabis at that time?
Yeah, so in terms of cannabis and substance misuse, it didn't often present as a primary issue. So cannabis use disorder, it didn't really often present as a primary issue. Cannabis was often used, alongside other drugs. But I did notice a pattern of sort of people using it to, manage stress and wind down and calm down and these kind of things. But obviously, with psychiatry as usual, if you like, there's a lot of demonizing of cannabis, and a lot of responsibility is placed on it for quite serious psychiatric disorders. And it's not that that risk is not there, but I think that there's more to the plant than just being a precipitator of psychotic illnesses. I mean, we've used it for centuries. There's still, there are whole religions based around the plant. And so to just completely write it off because of these risks, I think is illogical, because we use lots of medications that have, potential for really quite serious side effects, but we use them responsibly and with education. And, we should hopefully be, informing our patients of the pros and cons of anything that we prescribe to them. And then the patient can make a judgment for themselves with that information. But with medical cannabis, there is, well, with cannabis, I guess we were talking about, there is this kind of demonization of it. So it's difficult to unpick that, out of like treatment, I guess, and sort of start to view it as a potential medication, not just as this super harmful substance. It was almost like had to sort of deprogram myself in some ways, but I guess in some ways it was relatively easy because my background in terms of my culture, so I'm half Jamaican, and so I've always sort of been exposed to cultures in Jamaica like Rastafarianism, where the herb itself is a sacrament. It's not seen as a drug. It's seen as part of their like religious practices, and they talk about it in terms of like elevating consciousness and allowing people to reason, which is, in very, very simple terms, reasoning is about sort of understanding self and others and the world, and like viewing things from different perspectives and understanding each other. And so I never saw it completely as this super dangerous substance that maybe the propaganda from the 50s with the whole reefer madness videos and things was trying to portray, but how we could translate that into supporting people with it and utilizing it as an application to manage their mental health, I wasn't able to see that route. I think I just thought, the cannabis that's been legalized is just for really rare epilepsies, but it wasn't. It had broader applications. So with the patients in substance misuse, we wouldn't see too many that had problems specifically with cannabis, but I definitely saw it as part of their wider usage. But teasing out what role it played in their wider usage was a little bit difficult, because they were often, would you be using something else as their primary drug of use, if you like? And they would often talk about that in terms of managing their mental health. Often like anxiety was something that people are trying to manage. And cannabis, sometimes they would use it actually to help them with their detoxes as well. If you're detoxing from heroin, it can be really, really, really unpleasant for the patient, that withdrawal. And so some would use it to help manage that, essentially, with sometimes quite good results. Even alcohol, some people would use it to help them, when they're coming off alcohol. So I could definitely see that people were using it in more of a medicinal sense rather than a recreational sense.
Yeah. So in your sort of like psychiatry experience or training, would you say you've never had any teaching or experience of it in any positive way? It was sort of always seen as something problematic.
Oh, always,
Yeah.
always problematic. I cannot believe I had gone through my entire medical training and there was an entire part of the nervous system, the endocannabinoid system, that just had no mention. And it's not a new discovery. It's like over
Yeah.
50 years old that they, first described it and talked about anandamide. And, nobody talks about, the innate cannabinoid that we produce ourselves, which is anandamide, that utilizes this endocannabinoid system that we have. And we have all of these cannabinoid receptors all over our body. Why was it not talked about? It's just physiology. It's facts. It doesn't have any moral like leaning. It's just like I have an eye. I have cannabis receptors in my body. It's not, I don't understand what, well, I guess I can make inferences as to why it wasn't taught and talked about, but from a science perspective, like, to me, it's just a fact. It's has no political leaning, it has no moral judgment, no ethics. It exists in my body. Why was I not told about it?
Yeah. So what about your colleagues, sort of as you're starting to learn about medical cannabis? What did your colleagues think of that?
So they are just as surprised to learn about the endocannabinoid system. I think the in terms of like acceptance, it's quite mixed. So there's definitely a you know, I don't think, sadly, I do think, if I tried to go to the Royal College of Psychiatry like annual conference and I tried to talk about medical cannabis, I'm pretty sure there'd be, quite a hostile section of the membership that would have something to say about it. And in a kind of negative way, but equally you do get quite a lot, especially from younger students and people at this more at the start of their medical careers, just being more curious and interested in it. And I think that's just younger people in general. Their perceptions about things are quite different from generations gone by. And then obviously the research into psychedelics as well. So things like psilocybin, which comes from mushrooms, they are more interested in that kind of thing. And so cannabis kind of falls under that umbrella of emerging psychiatric treatments, if you like, because there hasn't really been much advance in psychiatric treatment in about 50 years or so. We haven't really had much different medications, types of treatments. So there's a lot of interest in this area. Yeah.
No, no, I think I have found that as well because I think it's also part of sort of like social media and our access to sort of like the news that we have and information that we have. And I
Yeah.
think especially sort of the younger early career sort of medics and healthcare professionals, they see it much more and they have a bit more access to a more nuanced perspective of it. So they are more curious. And I think as well, there's a sort of like this general shift towards, sort of maybe I don't want to call it like super alternative, but like
No.
other more
Yeah.
holistic approaches to
Yeah.
mental health and well-being in general. I see
Yeah.
this in the patients as well as in
Mm.
doctors. So I think there is that curiosity, and you're right.
Yeah.
I think it's sort of like this institutionalized like structures that we have with our like royal colleges, maybe not always being as up to speed with
Yeah.
like having these discussions, especially in psychiatry, where I really do see so much promise. I think, to be honest, I think maybe more in psychedelics than in medical cannabis because they've been incredibly robust and a lot more well funded as well with like their
Mm.
research and what they're doing. But yeah, with medical cannabis, it's a whole different story, and I think it's because there's such a negative
Yeah.
preconception of it, especially in psychiatry, with this association with cannabis
Yeah.
causes
Yeah.
psychosis. It's turned into cannabis
Yeah. Cool.
causes psychosis and
Yeah.
schizophrenia, which is not true. And I'm
Not,
wondering if you
yeah.
if you still hear that amongst your colleagues, maybe.
Yeah, you definitely still hear that because it's kind of drummed into you, right from the start of your psychiatry training that, super strength cannabis is available on, the streets. It's called skunk. We see patients, and quite young patients. And I think that's probably in terms of the worry about it is you do see these young patients, often young men, often young black men, young men from ethnic minorities who maybe consume quite large quantities of cannabis and end up unwell and being sectioned in hospital. But I think it's too simplistic to just say A equals B, the cannabis equals the psychosis. There's so much other pressures on these populations, racism being, a big factor, social exclusion, low socioeconomic status, poor education, poor health education and poor healthcare, housing, lack of jobs. Like there's so much additional pressure on this particular population. Does cannabis like modulate all of that pressure and lead to something more serious like psychosis? I don't know. I'm not a researcher. There's definitely an association. We definitely see more cannabis use in these types of psychotic illnesses. But what's the trigger, the link, the cause, that actual mechanism? We haven't yet, worked that out. So I don't think it's fair to just say, it's just cannabis. And, you know, I, being part of these types of communities, I think it's, I have to say, I feel like, trying to manage these kinds of pressures on yourself with a substance, I'm not surprised it happens. Like, I was very, very fortunate in terms of, so, I come from a similar background to some of these patients, but I was very fortunate in terms of, support that I got from my parents being very like savvy and being able to navigate social and political structures within this country to access bits of money to help with my education. But not everybody has that, sadly. And so some people get a very bad start in life. Their starting position is way, way back from the starting line. And so, to use substances to manage that pressure, I'm not surprised it happens. But I think this is where we have a lot of challenges in health equity, is how do we get, because I do think that there's a lot of managing of mental health that isn't spoken about, where substances maybe are used to manage mental health, but the people that are using those substances don't necessarily think that they're managing their mental health with these substances. So how do we kind of like talk to those people about that? Like, what are you doing? What function is it serving when you take up some cannabis? What's it doing for you? Why do you take it to manage, whatever it is, and the outcome that is coming from it, from the use of the cannabis? Like, helping people, I guess, to make those connections, and then maybe understand their use more, so that they start using it in a more mindful way, so that it then becomes treatment and they start to view it as treatment rather than something that they do, maybe if they're feeling a bit bored or whatever. So how do we move those people into a space where they feel comfortable about talking about their usage, and perhaps what that usage might be for? So is it for mental health? Is it for physical pain? And trying to build trust, because there is a lot of mistrust in ethnic minority groups, and quite rightly so, because often, institutions, whether they're supposed to be positive healthcare, for example, but, they have been weaponized against these communities, unfortunately. And people have ended up in hospital when they shouldn't have been, or because there's a lack of understanding about how certain communities and certain cultures communicate. And then that's marked down as mental illness, whereas actually, no, it's just how this particular section of society communicates or has certain beliefs that are perfectly normal, in that culture, but get labeled as mental illness. And so how do we build up trust, even with the GP? Like, never mind before they get to, psychiatric services, but even with the GP, just being taken seriously. Like, I mean, I don't know if, some of my good friends, who are from ethnic minorities and have, multiple health issues, it's often downplayed at the GP, and they don't get the same, referrals for investigations and for further input from more specialized doctors. It kind of gets cut off, it's health anxiety. So how do we begin to sort of like build trust, so that those communities can then go to their GP and access the right support, and then potentially come to somebody like me and access medical cannabis. Because the cost aside, just that I think is a huge barrier, like just the lack of trust and the lack of recognition at what they are doing is managing mental health. And then the cost part becomes important. I mean, I think in terms of private healthcare costs, medical cannabis is about as cheap as it can be. Um, and I'm grateful to the clinics for trying to do that. The fee that somebody will have to pay to see their doctor in a medical cannabis clinic is significantly less than, say if they went to Bupa to have a private psychiatric assessment. A lot of the companies, there's a lot of more budget friendly types of medication, definitely now making the cost more equitable in terms of what people can buy on the streets. So the cost of so you can sort of say to people, this is what you're paying on the street, but you can get it sometimes cheaper, sometimes equal cost to what is on the street, but what you're getting, and there's somebody who can actually give you a fair and balanced view of things as well, not just your dealer saying, oh, this is great, this is strong, this is, but actually let's try to understand the plant and give you something that's more suitable for your particular issues. And I think that's where the sort of local knowledge is really, really useful. Those that have, perhaps in more, what am I trying to say? So mining that knowledge of understanding of the plant from the community, like I would, they understand very well that different types of medical cannabis do different things, but like harnessing that and turning it into, scientific rigor is challenging. But I don't think we won't know until we start talking to them and trying to get that information from them.
Yeah, and they already have a distrust of institutions and healthcare professionals, but they have this really invaluable knowledge
Yeah.
and perspectives that I think like maybe more healthcare professionals can learn from. But obviously, it's how do we bridge that communication gap? How do we bridge that knowledge gap? So I wonder, so your transition into the clinics, and then working in the clinics, sort of how do you feel your training was in terms of getting to learn about this and sort of maybe putting some of all of this into practice?
Yeah, so I think, I mean, training was a challenge. So the UK Medical Cannabis Clinician Society is a really useful resource, but it's also kind of in its infancy, and so the knowledge base that's there is kind of in its infancy in terms of like prescribing. So it was like a very it was a really useful but kind of brief overview of things. And so most of the knowledge that I've picked up has been through more self-study, and also actually getting a lot of feedback from patients. So listening to what the patients say about their experience of different types of cannabis that's been prescribed to them. And just trying to see, what patterns are there. So basically, what's it called? Collecting real world evidence from the patients themselves, and then applying that, to new patients with similar backgrounds and similar stories, and just basically just building upon that, and then looking out for bits of research that hopefully, back up what I observe and what my patients observe.
Yeah. So do you feel there's enough support with like a lot of this unknown that you kind of have to, and uncertainty you have to deal with?
Not really. Like, I mean, no, I mean, like I said, the UK Medical Cannabis Clinician Society does have a really good forum. So if I've got a question about, it's usually when I've got patients that have comorbid issues. So there's a lot of patients who've got psychiatry as their main issue, but then maybe they're dealing with chronic pain, or maybe they're dealing with a gynecological disorder. So that's where maybe my knowledge reaches its limitations. I'm not a gynecologist, so I might go there and see if there are any gynecologists practicing and asking them, certain questions about things and getting their advice. So that's I think I find that the most useful source of support in terms of the current UK landscape. I mean, within your own clinic, and I think it just depends on the clinic. Again, the other clinicians that work there, you might ask them questions. And then what's quite nice as well is in medical cannabis clinics, there's a lot of close working with pharmacy prescribers and also nurse prescribers. And I think they also bring, a slightly different perspective to things. And so you can get a lot of information and support from them too. So it's generally, like, I would say, peer support that you get, and then individual like research and data collection that you might do, and then also looking at research that's produced and distributed.
Yeah. So do you think so I want to know a little bit more about what you think about the way this is sort of like set up, considering how complex the endocannabinoid system and how much uncertainty and risk. And of course, you access support from your colleagues and your peers. But again, in the UK, it's still quite early days.
Yeah.
So do you have access to maybe more international networks of colleagues who maybe have more experience in prescribing?
Not really, no, but I don't think it would. So the medical cannabis prescribing community is quite open, I would say. So, I mean, doctors in general are usually quite helpful to each other. So if I reach out, to somebody who's a specialist in something, you'll often get a positive response in terms of if you want to go and observe what they do or learn from them, you'll often get a positive response. So I haven't personally needed to reach out internationally because I felt like there was enough in terms of the UK support and knowledge and understanding to get that. But I have used international sources of information, certainly, to inform my practice. So, like, for example, the Canadian Health Board, has a whole bunch of guidance essentially around medical cannabis. Israel has been, utilizing medical cannabis for quite a long time now. So they have like quite a good body of research. They have something called the Green Book, which is really quite handy. And so you can pretty much go anywhere that's been either prescribing cannabis longer than the UK, and there'll often be like official documentation research either directly from the government or from important academic institutions that you can like access and have a look and see what they've been doing and whether it matches with the current sort of UK schools of thought and practices.
Yeah. So I wonder, with like you're having to do a lot of sort of like your own self-study and learning about this as you're going along and using a lot of sort of like non-UK sources of information. So how do you think like we need more in the UK? Do you think we need to spend more resources to do more medical research
Yeah,
and training here?
yeah, 100%, because there's a medical cannabis module on the e-learning for health, but it's just one module, and it's not the most in-depth, and it doesn't really help with the practicalities of prescribing. And I think that's where a lot of so there's definitely more interest in terms of doctors wanting to come and learn about it and become medical cannabis prescribers, but in terms of how they actually do the prescribing, the advice in the UK is very scant, and it's quite generic and doesn't necessarily help when you're faced with a list of 20 or 30 different medical cannabis flowers, the advice is quite right. Start with a low dose, titrate upwards slowly. I mean, that's very, very sensible. But which flower do I actually start with? I can start low and build it, but how do I, which, do I just throw a dart at a
Yeah.
dartboard and pick one? Like it's really hard for prescribers just starting out to know what to do. And I think if you don't have any kind of relationship with cannabis in terms of understanding how it affects people, I think it becomes even more challenging, because I think it's difficult to know. Let's say there's a 20% medical cannabis flower and there's 10 grams of it, and that equals 2,000 milligrams of THC. At the start, I have no idea, is 2,000 milligrams of THC a lot? Is it a little bit? Like, it's hard to know that. And so when you're trying to prescribe for somebody at the start, it's really, really challenging. So there definitely needs to be better and more structured support in terms of how do you actually prescribe. And I think that's what I tried to do in the grow presentation that you saw. Was I tried to sort of just explain to people how I methodically prescribe, so that I was trying to present what I felt was missing from my journey at the start. Like, how do I just start making these decisions about prescribing, and how do I progress, and what are the likely initial issues with prescribing that might crop up when you first give a patient a prescription. So yeah, there's definitely what we need is we need a BNF, but for medical cannabis, because then I think we will see more doctors feel more comfortable about what to do, in certain situations with medical cannabis prescribing, because they'll be able to look it up and go, right, this amount, that percentage, this kind of treatment regime, and they'll just, it's something that they can understand and follow. And then as you get more experienced, you can then apply it as dependent on the patient. But I think when you're first starting out, you need that guidance, and it's kind of lacking at the moment, I think.
Yeah, I wonder, because it is so complex, the first thing is to get a decent grounding on how the endocannabinoid, it's a biome actually, more than just a system. It's so much more complex than just a system, how it would even work. And that in and of itself, I almost see like a specialty training in and of itself over time. And then even thinking about, it's interesting you're saying to see it in a format like the BNF, because I wonder how easily does it translate to even fitting in that sort of format, because even with the names, they're highly variable. What kind of certificate of analyses are we doing? And then with the methods of consumption, the different methods of consumption, you still don't really know how much anyone is getting depending on what they're taking. And even from flower to flower, one part of the flower can have a different profile, of the active constituents you're trying to work, compared to even a different part of the exact same flower.
Yeah.
So there's just so much variability in this. And, I think sometimes if you come from a medical approach, you just think this is just too much. There's just too much variability. I don't even want to start. But then you kind of do have to start somewhere, because the patients are telling you this is working. You're getting the feedback that this is working. So yeah, it's super complex. And I wonder, number one, I wanted to ask how you're seeing your colleagues. Number one, what are you seeing is driving their interest in this? And number two, how do you see them changing their perspectives on medicine? Because this is very outside of the way that we're taught medicine.
Yeah.
Yeah, so maybe if you could comment on that.
I mean, I think the interest is being driven, for similar reasons that I mentioned for me, in terms of just feeling like, psychiatry 1.0, if you like, is doing the job, but just like just seeing those patients kind of stagnate. And so, there's a real sense of, what am I actually doing? Am I actually helping people by, yes, I'm giving them this medication, and then, I'm trying to make these referrals, and they're waiting, years for therapy, and it's sort of like this, I guess, this kind of impotent feeling that you have sometimes in psychiatry. Like, I think that's what drives a lot. I don't think they would admit it, but I think some have, experience of using cannabis themselves back, often when they were students, and seeing the benefits of it for, saying, like, maybe like getting to sleep or something like that. And so they can understand the benefits because they've experienced it themselves. Those that are, but those that, there's many more that don't have any experience of it but are still interested in it because they're hearing the patients either talking about it and, and being better and feeling better, and just wanting something different for the patients.
Yeah. And then in terms of them sort of transitioning into like trying to understand this whole sort of different approach to medicine, or different, way of even thinking about this as a medicine, like how are you finding people respond to that? Is it quite challenging for them? Do they stick with it? Do they end up sort of
They, no,
leaving after a while?
no, I mean, I haven't met many that have left, really. Most do stick with it because there is, I know it sounds a little bit selfish, but there's no better feeling than having a patient turn around and say, "This is the best I've felt in years," like, or, I can finally think about getting back to work because I'm feeling so much better, and oh my, I haven't slept like this for, a decade. So it's like that. I think, even with all the challenges around, working in private healthcare, having to like train and educate yourself basically in this whole topic area, you can feel a bit isolated at times. Like, that's what kind of keeps you in it and keeps you going, because you just regularly get these patient feedbacks and you can actually see them getting better. And it's a bit like, I'd love to be able to do some more social prescribing. Like, I see that in a sort of similar vein to like medical cannabis, in terms of actually being able to modulate someone's trajectory and turn it from a very negative to a more positive one. If I could prescribe patients dogs, I would do. But I think we need to just, in general, be thinking much more holistically about patients. And so many, of their issues are not necessarily always related to some, underlying mental health issue with a kind of, traumatic cause or something like that. Sometimes it's, unstable housing that's like causing the problem. And how do I can't deal with that as a psychiatrist. I can write all the letters of support I want and, talk about impact and this and that, but for the patient who's actually like living in it, maybe medical cannabis is the only way that they can sort of manage while they're going through something like that. And it just helps them to, feel less stressed about it, calmer about it. A lot of what medical cannabis does is give people space to process challenging emotions instead of being absolutely overwhelmed and taken over by them. And so that little bit of space sometimes can produce acceptance or a different point of view, or give them a different idea about how to move forward with something. And to me, the other medications don't really do that. And so that's kind of what keeps me going, is that this is something that's quite different from psychiatry 1.0. And so I can't really abandon it just yet, because I see all these benefits and I want more people to benefit from it.
Yeah. So I wonder if you think there's people that could benefit from it that just won't be able to, because of some of these sort of like other barriers you're talking about, sort of like, the social determinants of health. And I kind of feel similarly, like there's a lot of things that we just think if we could deal with these patients more holistically, but then we're really limited in the system that we're working within. So I wonder about sort of like the differences between you working sort of like more privately, and do you get more ability to think about working more holistically or in that way that you want to, versus when you're sort of like in the NHS, and if you see that as being better.
Yeah. So
Yeah.
you definitely get more, I feel like you definitely get more of a chance to, think holistically and talk holistically. And I think it's purely because I think patients feel empowered to talk about that kind of stuff. So, sometimes patients will come and ask me about psychedelics. So even though we're there, their primary treatment is medical cannabis, they feel comfortable to come and talk about psychedelics, or even just alternative therapies like doing yoga or doing Pilates. Like they feel that it's a more, that it won't be kind of like looked down on, like, what's a bit of Pilates going to do for you, kind of thing. I think they feel more empowered, and it's more of a safe space to talk about this kind of stuff. However, having said that, I don't see much ethnic minorities in my clinics. And I don't think it's just a cost thing, because there's lots of patients who are in the clinic who are on, maybe on benefits, maybe on a pension, so it's not just that they have money and that's why they're in the clinic. There's something else going on. And I do think it's about, one, recognizing that they have a mental health issue, stigma around mental health in those communities. I think we need to get, so society as a whole has definitely got better at talking about mental health, but certain communities are still way behind in terms of talking about mental health and accepting and understanding how it affects people. And so there's that. There's obviously, there will be a financial barrier for some, certainly, but I think when you look at the actual costs of medical cannabis clinic and you compare it to just buying cannabis straight off the street, there isn't that much of a difference. So for a lot of patients, if they can afford it on the street, I feel like they can usually afford it in the clinic as well. But there's definitely, I think, work that needs to be done around making it even. I would like to see it on the NHS personally. I would like to see no financial barriers whatsoever to accessing it. But I think it's about as good as it can be, given that it's in private healthcare land. And yeah, and I just think there needs to be, I think we need to involve the communities in understanding, why these ethnic minority communities are not accessing medical cannabis. We need to involve them. And I think we need to see the faces of ethnic minorities in this field being pushed to the fore. And, having patients from these kinds of communities talking about their treatment and their experiences. And then, yeah. Yeah.
No, I agree with you there. I think that there's already a challenge in, especially marginalized populations in deprived communities. They already struggle to access healthcare, and especially even trying to explain to them even simple things about medications, or even if you're talking about antibiotics and things like that. It's a totally different way of communicating. It's a
Yeah.
different type of relationship that you have to nurture. There's lots of different health beliefs you have to manage, and it does become a lot more challenging. I have to say, it really is a lot more challenging working in this patient population, because even at a basic level, like just trying to explain even the simples of, why am I or why am I not giving you antibiotics for this
Yeah.
thing, when you very much so expect that this is the thing that you should get because
Yeah.
it will make you better. And, even that in and of itself, you just, the rapport, the communication breakdown that exists. And then on top of that, they do face a lot of these other systemic barriers in general, like you're saying, well, like with housing is such a big issue. finances, access to opportunities. They've always got, there's always a lot of challenging family dynamics, and there's so much more support that they need from many different aspects. And I sort of see medical cannabis as like just a tool in the toolkit as part of
Yeah.
a more holistic approach to helping people like this, even more so. Because I wonder in my head, how would I even think about talking to these kinds of patients about something like medical cannabis, where they would potentially have a lot of experience, but maybe their own experiences would be so negative, and you just think, a lot of you are on a lot of medications.
Yeah.
Compliance already is quite poor because they tend not to see it as efficacious as much.
Yeah.
They have a lot of chronic conditions. It develops into something more complex, and the endocannabinoid system is like the homeostatic,
Mm.
system for the whole body. It helps regulate every other system. So you just think it has a potential to support them in quite a lot of the conditions that they have. But even how would I start to have those conversations with them? And
Yeah.
that is definitely something I wonder. I don't know if you've got any experience in that.
Yeah, no, absolutely. I think first of all, there's a lot of stigma just about cannabis itself that needs a lot. It needs almost like it needs like an educational campaign, and I think it needs kind of like high profile people who would be deemed functional in society, got good jobs, in relationships. Yeah, I think, whatever those kind of like markers of functionality in society, we need people like that. You need Mrs. Jones from Winchester, who, is director of her own company or something like that, and who's comes out to talk about, I use medical cannabis. Is, I'm the face of medical cannabis. Is this what you're expecting? Kind of thing. Like,
Mm, mm.
and just to kind of deprogram people that actually all sorts of people utilize medical cannabis and contribute to society and are perfectly, you know, functional and whatever. And, it's possible to be like that, to try to, I guess, to try to get rid of the stereotype of the stoner that's just, a layabout and lazy and, cognitively impaired and just, just out of it and kind of, just, there's just this crazy stereotype that, yes, there might be some people like that, but the vast majority of medical cannabis users are, just normal members of society from all sorts of social strata, all different backgrounds, in terms of their, socioeconomic and educational status.
Oh,
So
sorry.
yeah.
Was I right? Oh my God.
It's all right.
Is it cool? Carry on.
Yeah, so just, that kind of we need to see, it's like we almost like need some like celebrity figures, to just come out
Yeah.
and say, but like not, it's sad to say, but it needs certain sections of society to be like almost like the face of it, to kind of myth bust and get rid of this stoner sort of stereotype. um yeah, and I just think balanced education around it. I think one of the other big barriers as well is like currently at the moment, with medical cannabis having a requirement that people have tried conventional medication. I think that might be another reason why we don't see, especially in psychiatry, because if they are not trusting of mental health services in the first place, or even, going to their GP for mental health support and getting medication, they don't get on the medication to start with to then be able to qualify for medical cannabis. So I think this current system of it needing to be, it's not a first line treatment, I think is a shame. Like, because I think it takes away autonomy from the patient. And, if I have read a bunch of stuff about SSRIs, let's say, for example, and I've made a decision that I I don't want those potential side effects. I don't want those potential risks. Why should I be forced to go through that pathway of trying, maybe two of them before I can access what I already know because I'm using it on the street to manage myself? Why do I have to kind of like jump through those hoops? Because, healthcare should be a partnership. And I think already by having that as a barrier, the message I'm kind of giving as a healthcare professional is, I know better than you. You have to try these first, these medications which you're not happy with, which as an informed patient have come to your own deduction about. And then I'm sitting here telling you, no, you have to try those first before you can access the treatment that you have been self-medicating with for years. I think that's really unfair, and I think it's somewhat arrogant, let's say, of healthcare to say that I know best. It shouldn't be like that. It should be much more of a partnership. I think medical cannabis has really opened my eyes to like how a patient's understanding of their treatment can really improve and affect the outcome.
Yeah, it's sort of like that shared care,
Yeah,
situation that we're trying to be taught, like in our consultations, or at least in training, that like it should be
yeah,
shared care, always should be shared care, and you're coming up with a plan together.
yeah,
So this isn't ever really like that. And it's sort of like that, it's this weird like conflicting power imbalances and
yeah,
sort of knowledge imbalances, because a lot of the times, I guess patients tend to know more about this as a potential therapeutic option, or they have experience of it, whereas the healthcare professionals might not have that kind of knowledge base and experience. But the patients might not, have as much of that experience of all the other range of treatment options that we're taught about. But then even then, how confident can you say most GP? Because it's the front line is the GPs, isn't it? Like psychiatry is so difficult to access anyway. Therapy is so difficult to access anyway for most patients. They kind of most people will never even get to that stage. So, if you kind of don't, a lot of people don't always want to try antidepressants. They don't always want to try these medications. Or if they get onto the if they're lucky enough to get referred, it will take them such a long time. And sort of in the meantime, do we just
they
kind of just
do.
feel like you're leaving these patients and they've already lost trust in you. So then how can you be like a good healthcare professional to them if they don't trust you? And you sort of hold some of these maybe like negative preconceptions and judgments, but also it's not based on you having a good solid knowledge base on
Yeah,
this. It's based on bad evidence and no knowledge really.
yeah.
So I wonder sort of like how can we start to overcome this this kind of paradox that exists with medical cannabis, with like I guess more NHS healthcare professionals, because everyone sort of starts out as everyone goes through NHS training, everyone starts through with that. You don't automatically go into private, you just sort of end up going into private maybe after you've finished
Exactly.
training or something, because you don't see a way to fulfill, I guess, your own approach to medicine that might be more all encompassing, so then you kind of seek other opportunities, right? So I wonder like how can we start to change some of these attitudes maybe within NHS healthcare professionals?
So I think, so first of all, it's got to start in medical school. Like we've got to teach about the endocannabinoid system. It's a ridiculous scenario that we're in where we don't teach about it. It's not in any of the physiology books. It's just crazy. So get it in there in the first place. Get medical students, like they do for any specialty, coming and observing so that they can ask questions, they can do special interest projects in it, they can actually get some experience of it before they make the decisions about what they're going to specialize in. I think number two, and I think this one's really important, why I find it mad that GPs are not allowed to initiate medical cannabis prescriptions. You guys are just as qualified as any consultant, and you are perfectly placed to be able to start these medical cannabis prescriptions. And also, you're probably the healthcare professional that that patients come into contact with the most. Like in terms of a doctor, the GP is the type of doctor that most patients see more frequently than any other type of doctor. And so why are you guys not allowed to like talk about it and be able to even suggest it as, you know, as something that's a treatment? I think we need more kind of, I think we need to make medical cannabis in terms of widening access. So people that use recreational cannabis, I think they're fine because they often have, you know, quite a lot of knowledge and understanding, and, you know, they're not so influenced by, you know, propaganda around cannabis, so they're much more comfortable with it. But a patient who's completely naive to cannabis, you know, might have a lot of concerns, might have a lot of, you know, anxieties about the risks and stuff. And so I think if we can make medical cannabis, just the appearance of it, just look more like the medications that they're used to, that will help them to accept it more. If it comes in a, you know, in a tablet or an aerosol inhaler or something, like they understand that's medicine. And so I think that that will help. And then I think we need to engage the communities in terms of, you know, are you taking this because you just like to get high? And, you know, there's nothing wrong with sensation seeking. We as humans have been doing it since the dawn of time. But, or are you doing it because you're trying to block out some trauma, or you're not sleeping because you're super anxious about, you know, what's going on in your life? And if that's the case, like, come and get some support with it. Like, are you using it in a healthy way or in an unhealthy way? Like, and helping patients to sort of like unpick the distinction of that. And I think as well, I think there's a lot of knowledge that can be harnessed from like the Rastafarian community in terms of helping us to get the message out there with into the, because I particularly, obviously I've got, you know, a love for the Black community, so I want to see them being able to access that medication. And I think with the Rastafarian community, there is a really already like a really important understanding that they have that the skunk cannabis, the super high strength THC cannabis that circulates in the community, is an unhealthy type of cannabis, and they already understand, you know, that this can cause serious health and mental health issues in their communities. So they're much more invested in a more natural version of the plant, and also they're much more knowledgeable about the other parts of the plant that help support people, and also the application of the plant. Like, they don't just use it mindlessly. There is a reason that they will use the plant, and it's, you know, and it's part of their spiritualism, but it's also part of their consciousness. And so again, helping people to understand that there are healthy ways, and we have already examples within our community of healthy ways that people utilize cannabis. And so just, yeah, just sort of like spreading that message, I think, would be massively helpful.
Yeah. And I wonder about sort of, you know, like post med school when you like start to go into training about sort of like support and education there, because I wonder, you know, we can try and start to get the education there, but then we don't really have the follow-up. So for example, the e-learning for health module, I've done it. I didn't think it was very clear, and I didn't think it was very practical as well. I think it's quite complex, and it's just it's just not even remotely what you would really expect out of any type of medical training when you're trying to learn about a new condition or a new medication, and how, you know, you think about your approaches to assessment for that. So but if we were to start to do things like give more education, then, you know, then what's the next step though? So I could go on a course today, you know, as a trainee, but you know, then what? Like I still can't prescribe, or you know,
So
that's sort of like a bit of a catch-22, isn't it? Because we don't
yeah,
have the
I
rest of
think,
that support.
yeah, no, no, you're absolutely right. But I think we could. we could have a network of prescribers who are interested in medical education and want to support students. So, like for example, in the UK MCCS, they've put out a call. There's some medical students have approached them and they want to observe some clinics and things like that. And the willingness of the current prescribers is there. Like we happily will have anybody who wants to come and learn about it, but perhaps formalizing that structure and then having that proper pathway between the clinics and the educational institutions, so that they can send somebody for a 4-month elective if they want to, or they can it can be part of their mental health rotation if they want, but just formalize it. And there's plenty of examples of like technically non-NHS, because most of substance misuse is not in the NHS anymore, but they still support students from university to attend their clinics and things like that, because they run NHS contracts. So we can I don't think it would be that complicated to support those that are interested in it to come and learn more.
Yeah, so I wonder more in terms of like if you're already in a specialty training program, because you're closer to be able to technically prescribe, but then you're sort of like confined within the limits of like your training curriculum and that program that you're in. So I wonder about support there, what you think could happen on that level.
I think it just takes a creative program director, really, because say for example, when I was training, I did some time in a GP practice, but it was just built in to my standard psychiatric training. And I think if you've just got somebody who's just open-minded about it, it can easily be integrated and built in. Even half an afternoon, or going and spending a couple of weeks or something, but it can definitely be integrated. It just takes somebody who's willing to do it. Like, the clinics are out there, the doctors that work in these clinics are NHS consultants. Most of them are still NHS consultants. So it's not that the training from the supervisors wouldn't be equitable, because they've come through the NHS and and that formal route of training, so they understand how it all works. And also we're all used to having trainees underneath us, and what's required in terms of the paperwork that needs to be filled out, the assessments that need to be done along the way. So it's not like you're moving from one system within NHS training into something completely different, and it all needs to be all of these doctors and things, the consultants and supervisors need to be trained up in it. No, because we've all done it, we've all been through that system. So just get the trainees to us, and we'll happily train them and have them shadowing us and things.
Yeah, so has there been much effort amongst these sort of like prescribing consultants that you work with to then go back and say, okay, well, I'm like yourself, you're quite a senior consultant, you've got a lot of experience, you've done a lot of work in many different areas, but then for you to maybe approach training program directors to say, hey, this is something important that we think maybe some of your trainees could benefit from?
So there are definitely cohorts of consultants that are very passionate about this and kind of offer training sessions within their own trusts. So they'll do like like the typical like Wednesday afternoon, like
the teaching,
time sort of thing. They will offer themselves up, if you like. And there's like like for example at Birmingham University, there's a whole medical, student medical cannabis. And when I say student, I mean they're junior doctors as well. So there's like a whole little organization, and I've done a talk up there with them. So there are definitely doctors in the space that are motivated and already, but I don't think it's not the majority. And I think that's just time pressures, really. But if the institutions looked for people and approached people, then I don't think they'd have trouble finding willing participants.
Yeah. Okay. So I wonder, sort of, to, wrap it up a little bit, if you're thinking about sort of developing this industry in an ideal world, thinking about all the sort of inequities that you see in it, how do you see the future of this space?
Gosh, that's a difficult one, because I thought by this stage we'd be seeing more patients that are naive to medical cannabis coming to the medical cannabis clinics, and seeking out alternatives to pain, opiates and antidepressants and all this. And I haven't seen that. And I think I think it's one, there's still just an ignorance that medical cannabis is a thing. So a lot of people don't even know that it's a medication potentially that can be prescribed. Two, just getting over the stigma, having the medication in formulations that look like medication. And just sort of like normalizing the understanding of it, and how we can harness it and manage health and why it works. I think there's just so much like education that needs to happen, and destigmatizing that needs to happen, before I think we'll see real access to it. But yeah, how we do that is I'm not sure. Right.
Yeah, I think it's going to take a lot of different actors like hitting it from a lot of different angles to be able
Yeah.
to sort of like improve the access, and also maybe just rethinking the way we sort of, approach medicine as well, and how we, have more of a, as you're saying, like a holistic approach, but how do we start to transition medicine and healthcare into that way that maybe is more beneficial for more patients? But this is a very big systems thinking that we'd have to sort of, tackle bit by bit. But yeah, thank you so much for joining me and sharing your insights. It's been excellent. So thank you so much,
No
Louisa.
worries. Thank
All
you.
right.